Around the world with MS World. We're right here in Philadelphia, in the birthplace of the country, and the birthplace of actually a lot of American neurology. And I'm so happy to be here with Dr. Andrew Wilner, who's an epileptologist and also a neurohospitalist. Now, sometimes doctors, we just take care of patients. Sometimes we get involved in bigger things, and sometimes we even write books. Now, you wrote an excellent book called Bullets and Brains. Why don't you tell us a little bit about it?
Oh, thanks, Dan. It's great to see you again here in Philadelphia. Bullets and Brains is my latest book, and unlike my previous books, which were all on epilepsy, this one covers all of neurology. And these are short essays, 2 and 3 pages. There's over 100 of them in the book that I've published on Medscape.com over the last 5 years. I try to address ideas in the news. For example, the title, Bullets and Brains, comes from the shooting of Gabriel Giffords. And when I read about that, all of the emphasis on the news stories was what great care she was getting, which was true. She was rushed to the hospital. She was in the OR in 32 minutes. She had world-famous neurosurgeons. But the truth of the matter that somehow never really got into the news was that this is a brain injury is devastating and life-changing. And we don't have magic drugs. We don't have neuroprotective drugs. All we do really is clean out the wound and give some antibiotics and pray. And I thought that really needed to be emphasized. So there are other stories in the news that I found very interesting. For example, there was a woman who had a stroke in Antarctica, and she wanted immediate evacuation so that her stroke, we all know time is brain, you should be evacuated right away. But it was wintertime in Antarctica, and there's no planes that can fly because the fuel freezes. And so it was a big dilemma, and this story went on for weeks and weeks. So I pursued that and read about it and wrote an article about it. So there's a lot of interesting stories in this book.
Now, you have a very unique experience because you're both a physician, a neurologist, and you're a reporter. So when you just watch the news, how does that impact you? Every single word, does it mean something to you? Do you think about what the reporters are saying? Or how do you watch the news differently than, say, I watch the news, or, say, people back home at MS World watch the news?
Oh, I think that's a very good question. In fact, I've written several articles now about medical marijuana because this is a huge topic in the news. And I watched Sanjay Gupta's documentary, which is called Weed, because I'd heard a lot about it, and it had, I think, over 1 million viewers. And I watched it, and I was very distressed because what was being presented as a documentary, although I don't think there were any untruths in it, there was bias and slanting and emphasis that really was not balanced. And so that provoked me to look into that. I've read every article there is on medical marijuana. In fact, I just wrote another one. And because in epilepsy, I'm an epileptologist, this is a big, big topic. And right now, finally, there are actually clinical trials to determine scientifically, does this help or it doesn't help? And that will be very helpful because up to this point, right now, on that particular topic, we really don't know. And there's an essay about that in this book as well.
You know, talking about medical marijuana, since you brought it up, yesterday we were able to go to the press conference and then interview the co-authors of the systematic review by the American Academy of Neurology about medical marijuana in certain brain conditions. What was interesting is, although in the media everyone talks about epilepsy being cured by marijuana, the actual systematic review did not show a benefit for epilepsy.
That's
so
right.
How do you, as an epileptologist, when someone comes to you and says, well, I saw on the news that it works, why can't I be on that?
Yes, you bring up very important points. Not only that, I was at the press conference yesterday as well. There were 2 patients who developed seizures as a side effect from the medical marijuana. But in fact, there are anecdotal reports. Charlotte is a good example of a young child having hundreds of seizures a week. She took a special preparation of marijuana, now called Charlotte's Web, and people are rushing to get this. Whether it really even worked or not is not clear. And there is no evidence, scientific evidence, that medical marijuana is good for epilepsy. And it's a little bit sad. I do a lot of medical mission work every year in the Philippines, and I got a call just before I left a few weeks ago from a parent of a child who has intractable seizures. And she said, we're thinking of spending money to to come to the United States, to Colorado, so we can get medical marijuana for my teenage daughter. And I said, you know, and a trip to the U.S. is very expensive for someone from the Philippines. And marijuana is illegal in the Philippines, so it was not an option. They're pretty serious about drugs over there, so that was not an option for them. So I said, you know, I think your money would be better spent if you come to the United States, take a flight to New York or Los Angeles, and go to one of the tertiary epilepsy centers and see one of the experts. And I bet you'll have much better results.
Because there actually are a lot of options we have now. Actually, epilepsy should be important to everybody. It's 1% of the population, but in MS, it's overrepresented. More people with MS have a little bit more epilepsy. We're not sure exactly the number, but it's more common. There are new epilepsy drugs being approved all the time. There's now epilepsy surgery. There's vagal nerve stimulation. There's a lot of research actually going on in epilepsy. And so if somebody is suffering from epilepsy or knows somebody who is, there's other options besides just going to get marijuana. There's other options out there with a lot more evidence. If you're interested in hearing more about different stories in the media, about neurology issues, then you may want to come and get the book by Dr. Andrew Wilner. It's called Bullets and Brains, and you can get it in a store near you. Thank you so much for joining us.
Thanks a lot, Dan.